Okay, good morning, everyone, and welcome to the Lynn Cancer Institute, our updates for 2025. We want you to know that this is important information for everyone, and Maria is going to be speaking today on our nutrition series. So we're very grateful, as always, to have Marie Mirandes educating us today on culinary pharmacy. At the Lynn Cancer Institute, we truly believe that nutrition is the basis of healthy living for our patients and survivors, as well as prevention for all of us. So, thank you, Marie, for always covering information that's good for all of us, prevention and when we're dealing with health issues. In the interest of time, Marie's bio was sent to you by email. And we ask everyone that during her presentation to take notes. She always has a lot of good information. And if you have any questions or comments, you can put them in the chat box or the Q&A, and she will have time at the end of her presentation to answer all the questions. So we're very proud to welcome you all to the Lynn Cancer Institute and to welcome Marie Miranda. Marie?
Oh, thank you, Jan, and thank you everybody for attending. Really appreciate your time that you're spending with me today. And today's topic is culinary pharmacy. Today's goal is to kind of review the health effects of natural whole foods in the management of general ailments common to cancer treatment patients. There can be a lot of initial nutrition related concerns at the diagnosis or as part of a person's cancer, and then as part of a person's treatment. And we want to kind of delve into what we can do with food and supplements to kind of help with that. There are many different foods that can act as a digestive aid. Cancer treatments can affect or impact our digestive tract, including causing nausea, causing gas or bloating, and change in our bowels, either constipation or diarrhea. So, foods and spices that have digestive aid properties may help to soothe this discomfort while the body heals from treatment. It may help also to address these concerns without so much medication intervention. If we can minimize that, that would be to benefit a person in this time. So digestive aids is we're categorizing kind of as nausea relief. Foods or spices that can help with GI distress and aid in general digestion um, from supporting the gut and the healthy gut. Nausea relief, the first thing many people will think about and try is ginger in many different forms. Ginger has been shown to help with relieving nausea. You can take ginger in the form of ginger tea, which is one of my favorites because that is also a warm beverage and very soothing and helps with hydration, which is ever so important during this time. You can do ginger candies or second candies. So a popular brand is called Gingins, and they have a soft chew candy. They also have hard candies that you can suck on. And these are helpful to suppress kind of that nausea feeling. I do always suggest that if you're going to take one of these kind of things, sip on some ginger tea, that you're also trying to eat within, much like you would nausea medication, within a half an hour or so, hour, you need to actually put some food in your stomach as well. Cinnamon is also very helpful with relieving nausea. I think that's a great spice to add to maybe your warm cereal in the morning, cooked fruit. I have actually been enjoying myself some baked apples or baked pears with cinnamon and ginger. I actually buy ginger bulbs, peel it a little bit, and grate it into my fruit as it's cooking. So that's a great thing to do in the morning with oatmeal or yogurt. So that can be very good for the belly and in our GI tract. Cilantro is good for nausea. Cardamom is good for not only that, but also stomach aches and gas and bloating, relieving gas. And nutmeg, again, all can be added into foods, but you can also add them into teas. So having a nutmeg tea or adding that into a ginger or a chai tea would be great. Chai teas incorporate a lot of these different spices, ginger, cinnamon, nutmeg, and can be very soothing. So that's a great offering. And again, teas add to hydration. GI distress, which could include those bowel changes, gas, bloating, diarrhea, things like that. Bananas and those cooked apples or cooked fruits, cooked apples, cooked pears. That cooking process establishes the pectins in the fruit, and that would be a soluble fiber that just kind of is very soothing to the GI tract, helps support our gut microbiome to kind of heal. And it's easier to digest than a raw fruit, very soothing. So highly encourage banana, cooked apple, applesauce, things like that. Bay leaves added into the tea or added into cooking can actually be helpful with GI distress and gas. Of course, you're going to take that out once you eat it, but cooking with that bay leaf can be good for your gut. Caraway, cardamom. It's said that if you chew on cardamom seeds, it can help relieve gas and stomach aches. Cinnamon, as we talked about, cilantro again, cumin, mint is really nice. It's very refreshing spice and can help with some of those taste changes that come up with treatments as well. Peppermint oil, actually, I didn't put it on here, but that can also help with cramping and GI distress. Nutmeg, lemongrass, and saffron. General digestion, fennel, buckwheat, yogurt. Certainly sources of that soluble fiber. Fermented foods to kind of support that gut microbiome are good for that digestion. A lot of the medications, antibiotics, pain meds, all these things we're putting into our systems can disrupt our natural microbiome, and we can repair that within days. So when we have the opportunity between treatments to kind of support our gut, that would be great. Blueberries, very healthy superfood, very good for digestion in our gut, source of soluble fiber. Anise. So we're going to eat foods and talk a little bit more about supporting that gut microbiome. For problems with the gas and bloating, for problems with diarrhea, which is a very common side effect of a lot of these chemotherapy medications, you want to do less insoluble fiber. And as I've mentioned a couple of times now, eat more soluble fiber. And we'll go through a full list of that in a minute. But bran and skins and raw vegetables and raw fruits can be a little overwhelming. It can be a little bit too much stimulation for the gut and may increase that gas, bloating, diarrhea. So we want to replace that with more of the soluble fibers in foods. Sources of soluble fibers are oats, barley. As far as grains go, pumpernickel, bread would be great. Specific fruits like mangoes, figs, berries, melon are better choices during this time. Just very soft and soothing and high water content. Sweet potato, white potato, just eating that inside. You still get a lot of good nutritional benefit, even though these things are cooked, because of that bright color, because of the potassium and soluble fiber and vitamin A in a sweet potato, beta carotenes, things like that. So avocado, of course, we talk about avocado being great as far as adding calories to foods, but it is actually a healthy fat and good for the gut and good for soluble fiber. quinoa for another grain. Now peas, lentils, pinto beans, black beans, are great as far as soluble fiber. They can be a little bit more gassy, so if that is an issue, consider that. But if you're not having that gas issue and there's not concern with the treatment itself, then these would be good options, and they're good as far as plant-based protein, which is important as well. And then managing blood sugars, which would come up also. So again, cooked carrots, cooked green beans, artichoke, asparagus. These are nice, sources of soluble fiber, and the cooking process softens and makes them easier to digest. So very good choices at this time. And if you need a little bit more or not particularly fond of eating any of these foods, but you need that extra fiber, psyllium or citrusel are actually good options. These types of fibers can be good in both situations where people have diarrhea or constipation. Most people think of Metamucil or these fiber supplements when we need to go, but psyllium can actually be very beneficial when things are too liquidy and too overstimulated. So consider that as well. But of course, I'm always a food first kind of person. Now, we talked about supporting the healthy gut microbiome, and I think it's very important, like we said, to reestablish those good bacteria, to reduce the risk of things like C. diff and deleterious bacteria from growing, and to rebuild that gut, help it to heal, because a lot of the benefits of the good bacteria actually help to keep our gut colon cells strong and healthy. So we're going to get support our healthy microbiome with the prebiotics, and that would be their fuel source to grow and be healthy. So oats and pumpernickel and barley, same things as the soluble fiber, but they're going to help kind of support that gut microbiome. Seeds like flaxseed, chia seeds, pumpkin seeds are also really good and good for healthy minerals and good for protein. So you can add flaxseed or chia seeds into oatmeal or yogurt or a dressing and a salad, something like that. Legumes, lentils, peas, corn, of course, again, complex carbohydrates that are going to fuel that good microbiome. Potatoes and plantains and green bananas, or not overly ripe bananas, are going to be good for the gut. Now here's an interesting scenario. When we can support what's called resistant starches in foods, they are good and healthy fuel sources for the gut microbiome, but they also are less absorbed. So people who have high blood sugars or diabetes or these types of concerns, they will not spike your blood sugar as quickly. So we form resistant starches in foods like potatoes and rice when those foods are cooked and then cooled. The cooling process is the important part because it changes the starch structure of that food and creates these resistant starches, which is harder to pass through digestion and harder for us to absorb. So they become fuel source for that bacteria, creating these short chain fatty acids and all the benefits that we get from those short chain fatty acids. So keep that in mind if you like, for instance, potato salad, or if you're cooking ahead of time, cooking the rice and maybe meal prepping, put them in containers, put in the refrigerator, and then reheating, you'll get better blood sugar management and better control from that type of scenario. And of course, to cooking with turmeric and curcumin, specifically from the turmeric, has shown to improve gut diversity and be activated by bacteria. So interestingly enough, a lot of people talk about, oh, turmeric is hard to digest, it's hard to absorb. We always pair with black pepper. But interestingly enough, they are finding that we may absorb more than we realize because of the added benefit of what our bacteria does in our gut with that turmeric. So keep that in mind as well. So certainly we're going to support the bacteria with any of these high fiber foods. So peas, broccoli, greens, Brussels sprouts, berries, pears, apples, strawberries, um, chia seeds, like we mentioned, quinoa. So these are all kind of good things to support our gut to heal and to improve. As far as digestive aids for taste, we mentioned mint as being very helpful when it comes to bad taste in our mouth or altered taste in the mouth. Basil can be a great thing to add into food. So sprinkling that on a pasta dish or pizza or something may just help with some of those altered tastes. Certainly worth a try. Lemon or lime, a lot of people do better with the extremes, the very sour, the very sweet. So if some people are, of course, can be bothered by too sweet, so try it. Try like a lemon or lime added to foods, and a lot of times just a few lemon drops on a dish or a food will kind of revive some of that taste. So try keeping that around as an option. Cinnamon, of course, can add a great flavor to a food. It can actually make something taste a little sweet without really adding sugar. If that's a concern, the mint, the sea salt, and then of course ginger, teriyaki, onion, garlic. When we have these altered taste concerns, dulled taste concerns, you want foods and dishes with strong flavors. So teriyaki, onion, garlic, ginger, those are going to be strong flavors that just tend to work better and just are more palatable in these situations for sure. The dry mouth is very common with, especially when we're treating salivary glands or head and neck, or a very common side effect to many medications. So something to try, mustard seeds on the tongue could stimulate a little bit of saliva. Lemon drops or lemon or juice in water. Again, that super sour can stimulate saliva production. Papaya can also do the same, kind of increase. Of course, lozenges with glycerin can also kind of help. Of course, when you have a dry mouth, you also want to take foods with a higher water content, something that's quite moist and will be better tolerated than dry foods. So keep that in mind, certainly. Sore throat, most people, when they have a sore throat, they have a cold, they have tea with honey and lemon. So certainly that's going to be helpful. Basil can be helpful for a sore throat. Grass, lemons. Lemons, of course, is a good source of vitamin C, which can help to fight colds. Certainly we know that. Same thing with lemongrass, cumin, cloves, basil, turmeric. Um, so I've seen a lot of posts about making these cold bombs, say turmeric, honey, ginger, lemon, kind of in the mix, and then adding it into your drinks just to boost the immune system, basically, is what we're kind of looking at there. Um, so moving on, a lot of medications and a lot of cancer treatments, especially when we're doing steroid, dexamethasone, as part of that treatment regimen, it can increase blood sugars. So they can cause hyperglycemia, and we want to regulate those blood sugars as best that we can during these times. So on treatment or coming off treatment, it's possible to have the elevated blood sugars from steroids or other conditions. Balancing carbohydrates and foods with protein and fat at the meal and fiber will help to regulate the rise in blood sugars from a meal. So we want to choose foods high in fiber, we want to choose foods high in protein, and we want to actually pair some healthy fats with that meal, because that will also slow the digestion of carbohydrates and simple sugars in that meal and kind of avoid that spike. So almonds and nuts are great for diabetics as far as snacks or adding to foods. Your barley, Your oats, beans and lentils, of course, even though they're carbohydrates, they're high in fiber and high in minerals. So that's going to be a slower digesting carbohydrate than other types. Cinnamon can be helpful with regulating blood sugars, and dates. Many people will say, oh my gosh, dates are so high in sugar, but not so much. The beta glucan, the type of fiber, and the type of sugars in dates is actually very slow to digest. So it's actually going to help regulate blood sugars. So we've talked about and had in our cooking demos a lot of different options for using dates to make little snack bars or little treat balls like date and walnut balls, or brownie bites that use dates and cocoa instead of sugar. So keep that in mind as good options to kind of help reduce those blood sugars. Of course, like I said, like beans and lentils, chickpeas, high in fiber, vegetables, high fiber fruits, and then consider those resistant starches, because that's also going to help minimize a spike in a blood sugar. The other thing to consider is the order of foods that you're going to eat. Eat your high fiber foods first or at the beginning of the meal. Your salad, your vegetable, your nuts, your protein, the healthy fats, and then kind of work in those carbohydrates in the meal. And that will also help to slow the digestion absorption of those sugars and the rise in your blood sugar. So keep that in mind as well as a strategy for eating. So blood pressure issues can become a problem from cancer treatments. Some people just naturally have high blood pressure. Certain cancer treatments can actually cause lower blood pressures. So that's important to realize. But foods high in potassium can help to manage high blood pressure, along with limiting salt, of course, and sodium in the diet. So, eating apricots and kiwi, garlic, artichokes, cantaloupe, beets, sweet potatoes or squash, green leafy vegetables, raisins, mushrooms, and avocado. These are all high potassium foods. And there are also treatments that will lower potassium levels. They deplete electrolytes. So keep this in mind in those situations as well. And if you're having the high blood pressure, maintaining hydration, watching the amount of salt, and then choosing more potassium in the diet can be helpful. Um, so foods have a significant impact on how our bodies function, and the cancer fighting potential of our diet. And although it's not going to cure cancer on its own, it's going to work complementary to help boost the immune system and reduce inflammation. And inflammation does seem to be a significant factor in damage to cells and cancer progression and concern. So when we can reduce inflammation in the body and support, our immune system, we can support our cancer treatment journey. So there is one protein complex that is being looked at. It's called nuclear factor kappa B. It's involved in immune and inflammatory processes. So research is looking into targeting that pathway, which controls the regulation of genes involved in many diseases, including cancer. So inhibiting that pathway is a promising anti-cancer treatment. So there's a lot of these kind of pathways and proteins on cells and things like that researchers are looking at as far as being able to control or treat cancer. Interestingly enough, there are some food or spices that help to regulate and influence this pathway. So, interestingly enough, a lot of the foods we've already talked about are also NFKB influencers. So, anise, basil, black pepper, caraway, cardamom, cilantro, coriander, cinnamon, cloves, cumin, fennel, we don't talk about it as much, but ginger, mint, nutmeg, oregano, parsley, rosemary. So, I often say don't forget your flavor in foods. Don't forget your spices and your herbs, because they're going to add that additional level of cancer fighting potential. onto the foods, these healthy foods that you're choosing to eat. So we certainly all know that turmeric has been well studied as far as reducing the risk of cancers. And ginger is good for the anti-inflammatory system, certainly. Mint, we've talked about as well. So keep those things in mind. And foods that fight cancer and inflammation, again, apples because of the quercetin. So not only are apples going to support our digestive tract, support our healthy microbiome, but we're going to absorb quercetin, which is a good anti-inflammatory antioxidant from the food to support our cells. Apricots for the potassium, asparagus for so many reasons. Again, good for the gut, vitamin A, vitamin K, folic acid, which folic acid is critical in repairing damaged DNA and regulating that process. Avocados for the oleic acid, fight cancer, glutathione, which can cleanse, reduce carcinogens. So definitely important thing to include in the diet. Barley for that, those lignans, those fibers to block estrogen receptors. Basil may reduce the effect of radiation on healthy cells. So again, great to add into those pasta dishes or pizza. Beans for that high fiber, reduce the risk of colon cancer. Broccoli, cabbage, cauliflower, kale, our cruciferous vegetables are a source of indole-3 carbonyl, which breaks down and blocks and weakens estrogen. Carrots, squash, sweet potatoes are orange foods for beta carotene, for vitamin A, and of course, celery as a good fiber to kind of support the gut microbiome. Of course, during chemotherapy, some of these may not be appropriate if it's causing GI distress or gas, or if you have certain implants or stents or things that's not appropriate in. But when we can introduce these things to the diet, of course, it's good for everybody. Cherries, cranberries, eggs, flax seeds, green tea is a potent antioxidant. So that's always a good fluid and helpful with the GI tract. Of course, we want to have our fatty fish, halibut, salmon, walnuts. If we're not liking fish, flax seeds are all good sources of omega-3 fats. So that's going to be anti-inflammatory and boost our immune system. Mushrooms have been studied a lot as far as cancer fighting benefits. So your Asian mushrooms are usually the most potent, but any source of mushroom can be beneficial to our gut and our overall health. Pineapple, of course, for the vitamin C, if it doesn't cause nausea or upset your stomach or something. Parsley reduces the effect of smoke, and those um, concerns. Pomegranate has been studied a lot as far as antioxidant, anti-inflammatory benefits. So we often talk about foods based off of different colors. So if you'll notice, we've got red and purple foods that are sources of resveratrol that will help to fight cancer. Red grapes, Concord grape juice, blueberries. We don't necessarily need wine to reduce the risk of cancer. In fact, you don't want wine. We don't necessarily want alcohol because that is a cancer causing agent. Whereas we can get the resveratrol, which is the beneficial phytonutrient from that wine, from the red grapes themselves, and the blueberries. Squash, carrots, pumpkin, sweet potatoes, all have been on our list for many different reasons. For the vitamin A, the carotenoids to boost the immune system. Nuts, walnuts, seafood, brewer's yeast, whole grains as source of selenium, include and along with plant-based protein and the fiber and the other minerals there. But the selenium can block estrogen receptors, so something you can consider if you have immune hormone-related cancers. Cooked tomatoes specifically have been studied a lot in men with prostate cancer. The lycopene that you're going to get from a cooked tomato kind of supports antioxidant and anti-inflammatory and supports that the prostate and turmeric paired. Like I said, you want to pair turmeric with that black pepper. It helps with the absorption. But we're also going to get some of that absorption benefit from our good bacteria. So we want to support our good bacteria as well. Flax seeds, garlic inhibits tumor formation, proliferation. And as much as sugars have gotten such a bad rap, I think there are certain sources of sweetness in foods that actually can have health benefit. We talked about dates and their, you know, the benefit for as being a lower, slower digesting starch and sweetener. But certain types of honey can also act to fight cancer to be similar to anti-estrogen types of medications. So tooling and manuka honey are sweeteners that can help fight cancer, much like tamoxifen. It can boost the immune system and have immune support because we're getting immune benefit from the bees themselves. If those are kind of a little too pricey, I would also buy local honey. Keys bees or local honey from this area will have the immune benefit to the bacteria and viruses that are in our environment here. So keep that in mind as well to boost the immune system. So we're basically kind of as to pull everything together and talk about lifestyle as far as our pharmacy or our culinary pharmacy. The Mediterranean diet has long been studied for its benefit to overall health. It is a classic example of a plant-based diet, but there's many different cultures that have similar plant-based diets. So really what you're kind of looking for is a large majority of the foods that you're eating are from fruits and vegetables. Sometimes those might be cooked in situations where we have GI distress, or they could be raw. But it is a large portion of the foods. Whole or cracked grains, same thing. In their certain situations, you may be doing brown rice and high fiber grain breads. And some, like with the distress during chemo, you may be wanting more oat and rye or pumpernickel to ease digestion. Pasta, of course, beans and legumes, if that gas and stuff doesn't become a problem. And choosing the healthy fats. We've talked about avocados, we've talked about olives and olive oils and seeds, flax seeds, chia seeds, all can be added in to support your immune system and reduce inflammation. Fish, of course, soy. I will just say, because many people have still giving the wrong kind of message about soy. Edamame, soy milk, tofu, tempeh are good plant-based proteins. There's not going to increase the risk of breast cancer recurrence or anything. And in fact, breast cancer survivors over a year who include soy in their diet have less risk of dying. So keep that in mind. And if it's something that you enjoy, don't be afraid. We talked about cooked mushrooms, and then, of course, our other herbs, spices, and teas, and dark chocolate that's going to support our immune system. So, as a survivor and as a cancer person on treatment, we want to eat to nourish. We want to move, of course, to help you thrive and enjoy life reclaimed. And I appreciate very much everybody joining us. And if you have questions, looks like there might be some things in the chat box. I am happy to answer. So let me. How do you reheat in order to not lose the resistance benefit? The interesting thing is you can reheat in any way that you want. It doesn't seem to affect the resistant starches. So once they are formed, they're not going to be changed back with a heating process. Date sugar is also good. I guess like a granulated sugar, I think is what you're talking about, or sugar they use in foods. I would assume so, yes. Would you recommend cancer fighting foods to patients who are already diagnosed? Yes. Like, are they still beneficial or are they no longer? No, I think they are still beneficial because a lot of the cancer fighting foods reduce inflammation, and a lot of our treatments are going to cause inflammation. So when we can support recovery from these kind of side effects or effects of treatment, then our body can recover faster. So absolutely, I would still recommend this. I would still recommend to people on treatment as a survivor long term. And like I said, within the parameters of what you can tolerate during treatment. And as we said in the beginning, if you're having those digestive problems or the GI distress or the diarrhea, constipation, consider the form or things like that that we talked about. But certainly, your plant-based foods, your foods high in antioxidants and anti-inflammatory are going to be good for you. Um, any studies on soursop fruit effect to cancer? There's not a lot of evidence that soursop is going to be helpful. Actually, I've had people use soursop, plenty. I think the only concern that has come up with soursop is if you take too much. If you take too much, it can cause like tremors, like a person who's having um, Parkinson's. But if it's something that you feel strongly about, you can. There is a great, actually, let me see. There's a great website, a Memorial Sloan Kettering website, which you can look up herbs and supplements and read through any concerns, any potential benefits, any interactions. So they have a very nice write-up on, potentially what can come from, what we can expect from soursop. Um, any other questions?
Those were good questions.
Yes, thank you very much. Those are very good questions. I appreciate.
Anyone else? Hey, thank you, Marie. As always, this was, oh, someone asked if you could please share the website. One,
Oh,
one good
if
thing,
you want
Marie,
me to, I can pull it up, maybe.
and
Um,
Marie always shares her slides with us, which is so generous. So maybe, if you contact myself or Lee, um, we can get the website from Marie if you don't have it handy right now, Marie. And we can
okay.
send it out to, actually, maybe we'll ask Lee to send that out along with the slides when she sends out the evaluation sheet, which will probably be tomorrow. And so we encourage everyone to fill out the evaluation. It's good for our speakers to know how you felt about the information that was provided. And I have to say, Marie does such amazing research. And this information truly is, of course, very helpful for our patients, but also, oh, there it is.
There we go. I for graviola, which is the other name for soursop. So that should be the link specific to that. And then you can, of course, always back up to the full database for herbs. So keep that in
Yeah.
mind. And yes,
So
we
look
can
on the
do
chat
that.
box. Marie just put it on the chat. So you can look on the chat to get it. And we'll get it from her and send it out to you as well. So,
Okay.
so Marie, thank you for your
You're welcome. My
research and
pleasure.
the way that you give us all information, both, as I said in the beginning, both patients and the rest of the communities that we can learn a lot for prevention as well in our general health. So this lecture was recorded. So if anybody would like to go back and listen to it again, in a couple of days, it will be edited and ready for us to send the link out to you. And it's also good to share it with other people that you think would benefit from this information. So just let us know. We'll send you the link. And I just want to give you a few more lectures that we have scheduled for April from the Lynn Cancer Institute. Excuse me, this Friday, April 11th, we'll be discussing head and neck cancers by our physician panel speakers, Dr. Micah Glon, Dr. Ross Taylor, Dr. Mathen Matthew, and Brandy Hyatt, Marie's colleague, our other oncology dietitian, will be also adding information to that lecture. Wednesday, April 16th, which is National Advanced Directives Day. Our presentation will be planned for tomorrow, today, the power of advanced care planning, what you need to know. And our speakers will be two of our licensed clinical social workers, Elsa Rayner and Ann Williams-Nicholas. And on Wednesday, April 23rd, Words from the Heart, The Power of Ethical Wills, will be presented by Rabbi Marcy Block, who is from Trustbridge Health. So we will be sending out the registration information to everyone. So if you're interested, please register and also fill out the evaluation form. And if you have anything that you'd like to comment on, please do it on the form. So thank you, everyone. Have a good rest of the day and the rest of the week. Thank you, Marie. As always, we're very grateful. And have a great day, everyone.